Hey, I'm Dr. Queen. I'm a board-certified dermatologist. I'm also a specialist in hair loss, and we are here today to talk about hidradenitis suppurativa. So hidradenitis suppurativa, otherwise known as HS, is a chronic inflammatory disorder of the hair follicles. It is characteristically presenting with tender, painful boils, especially in the underarm area, the groin, buttocks, even under the breasts. Some people are getting flares of these boils every week, some people every month. The other issue with HS is because it is a chronic condition, it isn't just a boil. Ultimately, with recurrent boils, you're getting scarring, you're getting fibrosis, these sinus tracts form under the skin that can really be devastating. An ingrown hair or a cyst is usually a focal area of inflammation. They can be recurrent, but don't tend to be chronic in the same way that HS is chronic. So where you have a ingrown hair, it's something that I can deal with acutely, right? So we can give you some antibiotics, maybe we give you an injection and it's going to go away. HS, on the other hand, will flare up similarly, so you might present same way, that you also have a little tender boil, but unlike an ingrown hair, it's recurrent and it becomes worse every time it flares. There is a stigma around not only this disease, but just having boils in these sensitive areas, and just bringing it up to a provider can be really scary to begin with. It's really sad for me to hear that sometimes people have brought this to someone's attention and they've just been told that it's their fault, when really it's a chronic inflammatory disorder and they deserve a long-term treatment plan. We want patients to advocate for themselves. Hearing more about how this is affecting you on a day-to-day basis, especially on that more emotional aspect. So hearing that it affects your self-confidence, that it's getting in the way of your socialization and your relationships, it really helps put your disease in context and will help your provider just provide you with better options. Questions that you can ask your provider: if you're already suspecting HS, you can say that. You can say, hey, any chance that this is HS? Sometimes if providers are too busy or they haven't gotten the full story, they might not even be thinking about it. So bringing this up is actually very helpful, and I think most providers will listen. If you are concerned about HS, there are a few important things that you want to tell your provider. You want to tell them how often that the flare is happening, where it's happening, and the severity of your flares. Knowing all three pieces of information allows your physician to really create a targeted and individualized plan for you. I hope this has been helpful. Of course, nothing is a replacement for seeing your dermatologist or a specialist in HS. Having that clinical evaluation in person is really important for your treatment plan.